Earlier you mentioned SpaceOAR, which is the gel that they inject to separate the prostate and the rectal wall to protect the rectal wall from radiation. So my question is, can you use that to prevent side effects from brachytherapy?
Yes, absolutely. The brachytherapists that we use install a SpaceOAR gel separation in all the patients that they treat.
I know that you send everybody you send to basically has and uses SpaceOAR, but is this common around the country, and should a patient call ahead and see if his radiation therapist is going to be using it?
I think it's a good idea to call ahead. There are skilled doctors that can get by without SpaceOAR, but I don't think any of them can guarantee that the rectum won't get burned. They can say that the risk will be very, very small, but not zero. And so if I was going to have a procedure like this, I would definitely do the SpaceOAR.
I know we've talked about rectal burns before, but can you explain the gravity of what would happen if the rectum did get burned and the permanent side effects that would happen?
I mean, this is one of the arguments that surgeons used for years not to do radiation. And the problem is that radiation burns, the serious ones, never heal. So to have a sore in your behind that's bleeding intermittently for the rest of your life, where you have to be reminded every day what a mistake you made having radiation, it's a terrible disaster. So the technology, the targeting technology got a lot better and reduced that risk to very small numbers, but now with the advent of SpaceOAR, you can essentially eliminate that risk, and it's obviously a prudent thing to do.
So, still talking about SpaceOAR, one of the questions that we get asked is in regards to IMRT, because IMRT is, for quite a long time. And so the patient is concerned that if they get SpaceOAR, will it last long enough to go the duration of the IMRT treatments? Yeah,
it was originally designed for IMRT. So it's a very elegant chemical formulation. So the gel, after it's installed, stays in the area between the prostate and the rectal wall for about 90 days. And then, right on cue, it dissolves and turns into water and disappears. So such a clever methodology that's been developed, and it's more than adequate to cover the usually 5 to sometimes as long as 9 weeks of IMRT therapy.
Thanks for watching. If you would like more information, you can visit our website at pcri.org. Also, subscribe to our YouTube channel. We come out with new prostate cancer videos every week.